So please welcome Christina's mother, Emily Tarcell. Thank you so much for being here. First of all, I'm so sorry about your daughter's death, just 21 years old. Tell us a little bit about Christina, Emily.
She had a great curiosity about life. She was an athlete and an artist and a philosopher.
Sounds like an outstanding person with obviously an incredibly bright future.
Right.
Did you all decide together that she would get the HPV vaccine?
When she was 20, we went to see the GYN for her first visit. The doctor was telling us that Gardasil would be safe and effective, would prevent cervical cancer.
Let's talk about Christina's experience. I know that she had symptoms after each shot was administered. What were those symptoms?
Well, because we have a case pending, I cannot go into detail about what happened each time. She was previously healthy, had no existing conditions, but it did begin to develop some things. You know, oh, I have a rash. Wonder what that's about. I feel fatigue. I feel dizzy. And she reported this within a few days of her third shot. And within 18 days of the Gardasil shot, she was found dead in her bed.
When was the last time that you saw your daughter?
She was going back to Bard to be trained for a job that she'd have there on campus during the summer. So I hugged her, and I can still feel that embrace, and I let her go, and that was the last time I saw her.
You have, I know, filed a federal claim because Gardasil was approved by the FDA. Why did you decide you were going to do that?
If you have reason to believe your daughter died and from a product that caused her death, you want to hold people accountable.
Well, we reached out to Merck, the manufacturer of Gardasil, and in a statement, the company defended the vaccine, saying its safety was established in clinical trials involving more than 25,000 females and males. They continued studying more than 500,000 people after more than 1 million doses had been administered. And the statement went on to say, parents should understand the extensive data supporting the safety profile of Gardasil, and we encourage them to look to the CDC and FDA and to the advice of their own physicians to make an informed choice about something as important as a vaccine to help prevent cervical cancer. Dr. Diane Harper is a professor at the University of Louisville and an international expert on HPV and HPV prevention. I know, Dr. Harper, you were an integral part of the science of bringing the HPV vaccine into human trials. So why initially did you think this was such a positive development for cancer prevention?
I was very excited initially because I thought, yay, we have a vaccine. This could be really important, especially in countries that don't have any screening with it. But then I started looking at what isn't covered, and I looked at the fact that Gardasil doesn't last long enough to prevent cervical cancer, and HPV infections are something women continue to get throughout their lifetime. The other thing that, in looking through CDC data as well as other published data, is that HPV is most often sexually transmitted, but between the age of birth and 11 years of age, 10 to 15% of these children are already infected with these high-risk types. So it isn't that you're completely negative until you're 11 years of age and then you're at risk. So there is an underlying infection rate already that's there. So that makes it
not being, it's not from sexual activity, it's just because they have the virus.
There's some kind of cutaneous transmission. It's always skin-to-skin transmission, and there's some kind of cutaneous transmission, whether that's parental, whether that's babysitter, whether that's bathtub, we don't know.
So, are you saying that you would now not recommend girls or boys get the HPV vaccine?
In the concept of cervical cancer prevention, what I think is important for people to know is that Gardasil is an option. but that's all it is an option. And if you feel comfortable that you want to take the vaccine to prevent yourself from getting an infection for a certain amount of time, that is your right to do. That is the benefit of taking Gardasil, is that will happen. But as we've heard, there are also some harms associated with it.
In your expert opinion, do the benefits outweigh the risks?
We have Pap screening now in our new recommendations that just came out a couple of months ago that use HPV testing and cytology together. And those,
What's cytology?
I'm sorry, Pap smear cells, right. When you go in, you get those cells scraped off your cervix. We put those two tests together. We have nearly 100% ability to find precancers, which can be treated at 100% cure rate, and they can detect cancers. It's a much better Pap test than the one we've had in the past, which has not been able to detect all the cancers, even if you get them. So at this point, what I think that is most important for people to understand is that Pap screening is key. Pap screening is key to all of this. If you get the vaccine, you still have to come in for Pap screening because of the other HPV types that could be causing changes in your cervix.
And with boys, boys can get a number of cancers if they have the HPV virus, correct?
Correct. The kinds of cancers that boys can get are anal cancer and head and neck cancer are the two, penile cancer. All three of those cancers occur in very low rates. NIH defines those as rare diseases. The only exception to that is in men who have sex with men. And in that population, the rate of anal cancer is just as high as the rate of cervical cancer before we have Pap testing. But in boys, again, the efficacy is no more. The trials lasted 3 years. So the long duration of protection, if you're vaccinating somebody at 13, may not last long enough.
I had no idea that it only lasted for 5 years. I thought it was a lifetime protection, knowing that still Pap smears were necessary, but I didn't realize the efficacy basically wore off after 5 years. So when you hear about this, Emily, and you hear Dr. Harper say these things, how does it make you feel?
Well, it is the reason I'm here, because it's an outrage. So that's why you have to know, and you have to take responsibility for finding out.
Well, Emily, thank you for coming and talking to us about this important topic about your daughter, Christina. And I know it must be very painful for you to do that, but we appreciate your being here and telling us your story and her story. And Dr. Harper, thanks to you as well.